Hello, DAT cohort of 2019. So, in this reflection, I'm going to talk a little bit about my experience throughout this past 3 years that I've had here at Indiana State University. So, I actually just read a letter that I wrote to myself from 2 years ago, and I just read it and kind of reflecting back on my time here at ISU, and I can kind of see the progression on how I have actually grown throughout this program and how I'm so much better as a clinician, as a person, and that's something that, you know, you signed up to be in a DAT. However, one thing that I don't think you may understand at this point is you signed up for an experience that's going to take you for a pretty wild ride, personally and as a professional. And that's something to be very proud of, that you've gotten this far, that you are part of something very special. I actually just got done with some interviews all over the nation. I was in Boise, I was in Wisconsin, Atlanta, and Chicago. And one thing that I realize is that people are starting to recognize what a DAT actually is, and the interest of wanting to learn what a DAT is out there. You're gonna have those people that think a DAT is stupid. They don't understand it. Why would you spend the money to go throughout, 2 years just to get a glorified master's degree? And I've heard those things where people have said it's just a glorified master's degree. And you really have to defend yourself. And you're going to come across those times where family members or professionals or people that you're really close to think what you're doing is stupid. However, I think once you go through this program, you will be able to defend yourself and really understand, what a DAT actually is, and how proud you should be of yourself for completing a DAT. Um, I guess probably the biggest word of advice that I would give you going through this whole process is to be open-minded. There are going to be things that, I've looked back on and I thought were really stupid, and but I use them in my everyday practice. And having an opening or having an opening mind really allows you to really be better as a clinician and really look at your patients rather than just who they are and what their injury is, but looking them at as a patient and as a person that has to live with whatever injury that they're living with. And I think that's kind of the most important thing that I can take away from the DAT is how I can better affect the people's lives that I interact with on a daily basis. And you see it every single day with some of your clinicians that you may work with that they don't understand the person that they're talking to, the person that they're treating. They don't understand that individual, and they just treat the injury. And I think that's very important to recognize throughout your time during the DIT. Another bit of word of advice is that you're going to have your good days, you're going to have your bad days. And I can't, I lost count of how many bad days I had, and I don't want to scare you or anything like that, but you're going to have your bad days, and you're going to have those days where you think you can't do anything right. And I've had my fair share of those, but it's how you come out of those situations that make you a bigger, better person and a better clinician. And going back to, this DAT program is going to make you a better person, not just, what you do in the clinical setting, not just what you do in the classroom, but how you are when you go home and how you are around your friends and your loved ones, and really builds a person rather than a student or a clinician. So just keep that in mind. In every single assignment that you do, there is a purpose to it. And you might have disagreements along the way with Dr. Everman or Dr. Powden or Dr. Games on why am I doing this? And if you have that question, ask them, because there is a purpose behind every single assignment. So if you don't understand why am I doing this, doesn't have any application to what I'm actually doing, because you're going to be doing a lot of different things. And some of you might be coming straight out of grad school, or some of you might be practicing for how many years, but just know that they're going to do things a lot differently, and you're going to have to look at the way that you've done uh, practicing as a clinician for the past 10 years, you might have to throw it all out the door. Or you might have to have a very different viewpoint of what you learned in your undergrad, because there are going to be some things like you look back on your clinical education and you look back at it and like, why the hell was I doing that? And, and trying to have an open mind and changing what you are doing. And I think change is a good representation of the DAT. So that's just a little bit of advice that I can give you. Keep your heads up. I know it's only the beginning of the semester for you and the beginning of the DAT, but the 2 years goes really fast, and really cherish the next 2 years, because with your classmates, you're not going to see them very often. You're going to be interacting with them through DAT weekends and on collaborates and things like that. But really cherish those moments that you have with your classmates, because you're going to see them. You're going to see them again. Whenever you graduate, you'll bump into them at NATA, or they might be in your working employment, so just be aware that anything and everything that you do, you're a representation of yourself, you're a representation of the program, and you're a representation of myself. Coming from a program that, all of us represent each other. There's not, you don't just represent yourself, you represent myself. So anything and everything that you do, um, just be aware that you represent this program, and just make sure that's always in the back of your mind, and do great things for the profession.